Hello.
Hi, Dr. Nell. How are
Hi.
you?
I'm good. How are you?
Friday.
Yes, happy Friday indeed. How's it
Ah,
going over there? How's your family? How are you doing? Everybody safe?
yeah, everybody's safe. We're all just quarantining at home. Um, and it's funny because your followers probably don't know this, but I'm actually 6 months postpartum. So I've just have more time with my baby, which is nice.
That is nice. Well, on that note, do you want to give a little introduction about, who you are? And we're going to be talking about postpartum and postpartum support, but, fit into that also how you even got interested in this topic because it's something we're both really interested in.
Yeah, yeah. So my name is Debbie. I actually went to Emperor's College. Dr. Nell was there during that time as a clinic manager and also getting your doctoral degree at the same time. So I actually have been, when we were in Chinese medicine school, I was always interested in postpartum. It was something that always was something you hear about in my culture, but you don't quite know what it's about. A lot of times, a lot of people were talking about, oh, it's that thing that you do for women after they have a baby. And, you do things like don't shower and go outside. So those were the things I would hear about. And then actually, when I was finishing up school, I actually got pregnant last year. And that's when I started to go into a deep dive into this because I was so interested in what it was all about. The good thing is that there's a lot more awareness than before, with the new book, that book, The First 40 Days, where they talk about nurturing the mother. And I started to go on a hunt trying to find everything I could possibly find about the Chinese confinement period. And as I was learning more about it, I found that every single culture has their own version of it. I know the Middle Eastern culture has it, the Latin culture has it, all Asian cultures have some form of it. But there really was nothing here, for Western women.
Mm-hmm.
And it was something that, unfortunately, there's some books on it, but not a lot, giving like step-by-step guides. So my mom and I just started researching, like, how do we do this? How am I going to do this? What kind of foods do I have to eat? What practices are you supposed to follow? So that was where my interest came about. And I joined a mom group, and looking around, I found that everybody here, because families are so spread out over the United States, the parents could be on the East Coast versus the mom on the West Coast, and just not having a lot of support here. Um, a lot of women do it alone. And I think it has a lot to do with American mentality. Like, everyone is very independent and tries to do everything at once. And this really teaches you the art of letting go of all of that.
Well, because it is all about that pressure, I think. And I think, I did a podcast episode with a woman, I think Sally's watching right now, who's an incredible massage therapist and focuses on the postpartum period. And what we were talking about is that, yeah, like you said, there is no framework, there is no setup, there is no really breathing period. It's all about like, well, are you going to get back to where you were? And the idea that, it should be a forward moving process and not something you're ever trying to get back to. But, you know, my interest with postpartum was similar in that I look at it with my post surgical specialty. Like there was a trauma that happened, and then where is the support for that trauma so it can continue to blossom into this really exciting and amazing thing that just happened. But yeah, that special time that should be really like cultivated and supported is often not here in Western culture. And why do you think that is? Do you think it's just like you said, everybody's spread out, or is it that we have such a mixture of cultures here that there's no standout way to do it? What are your thoughts on that?
I think it stems a lot from the fact that America is such a melting pot. we have so many cultures coming into America. There's so many first generation, second generation, third generation cultural families, right? And a lot of it is lost. Once you cross a border, a lot of this information is lost because it's not something that is focused on in this culture. For example, my mom, she immigrated to the United States when she was in the 80s. And she was very much alone here. Once she had me and my sister, there was no one to take care of her. She couldn't really speak the language. She probably had a very small community of friends. Neighbors were, Western, so they didn't really know about it. And so a lot of it just has been lost. The art has been lost here. I mean, the same goes for in California. There's so many Latino cultures too, right? Once they cross the border, they're usually by themselves. Eventually, everyone brings their family over, but that's just not the focus. I don't think that Americans have that in their culture too. It's just because everybody immigrated here, right? Pretty much. And when you're alone, the framework is just not there. So I think that's a big reason why. And also because of the American very can-do attitude, everyone brings everything onto themselves. I can do it all. On one aspect, it's great to have that superwoman mentality because, everyone's pretty much a go-getter. But at the same time, there phases in your life where you do need a lot more support, and it goes against a lot of how you're raised over here.
Yeah, I had a functional medicine instructor, Dr. Colleton, and he's just one of my favorite teachers, but he always, and it's interesting as a man to have this perspective, is very aware of the pressure that is put on women, particularly in the US. And, we were having a conversation about, why are autoimmune diseases so common with women compared to men? And one of the things that he always would come back to in so many of our different classes was there is no one in the world that is more taxed and more stressed than the American female.
Yes.
And it's very much what we're talking about, that, there's not that allowance for, well, let's look at what just happened with the human body and this situation that is unfolding, and adjust accordingly. It's like, oh, business as usual. Well, it's not business as usual.
Yeah. Yeah, I completely agree. I feel that so many in the US, I mean, when I'm treating in clinic, there's so many women with autoimmune issues, with the chronic illness, so much. And I think, I suspect a lot of it has to do with, first of all, I mean, you and I understand that, in Chinese medicine terms, like just burning through your life force, burning through your kidney gene. That's, like you said, that's how it is. And also, I think for the women that have had kids, it may stem from the time of their postpartum. You're so depleted with your blood, with your qi, and in Western terms, it's more like, your minerals and your nutrients, you're completely depleted. You went through this marathon, right, of birthing a new life, of creating a new life and birthing a new life. And a lot of times the first thing they eat is sushi and salad. How is that going to replenish your body, right?
Yeah. So let's talk about that, the Chinese medicine perspective. And, I really think a reframing is necessary with that too, because I think a lot of times people are like, oh, well, that's Chinese culture. That has nothing to do with me. This is integrative medicine. This is medicine, period. This is what does the individual, the patient who's sitting across from you need in this moment. And anyone, regardless of cultural background, needs nourishment at that time. So, in working with postpartum women, what are your recommendations as far as nutrition goes? What we learned in school, that traditionally has been very helpful.
So it's interesting. Like everything in Chinese medicine, it depends on where you're at, what your current symptoms and your patterns are, right? So what you eat when you immediately come out of childbirth, the first week is very different from your second, third, and fourth week. And I think that's very important because a lot of times people are like, they like to eat the same thing just because it's easy, but you sort of have to adapt to where your body meet where your body is at. And that's the same with like functional medicine too. You're constantly looking at the lab work and figuring out where you are in your healing, and you make adjustments as needed. So generally in the first week, because your body system is so weak, generally it's recommended to have very simple foods, but at the same time, not too nourishing. Things like red meat or lamb or anything like that, you want to eat in like week 3 or week 4. So you want to start off having very simple like porridges, oatmeals. Don't add too much of those superfoods yet. Like save that for a little bit later. You know, I know everybody's tempted to add like all the flax, all the chia seed, all the goji berries and everything, but just very simple like rice porridge or oatmeal. And then generally people recommend chicken soups. And when you think about it, that makes a lot of sense when you're in the middle of the flu or a cold, when your body is weak. That's what you generally take to replenish your body. And that's the same that goes with Chinese medicine too. Because chicken is so warming, it's actually great to eat. Just a very simple chicken soup, add a lot of ginger because that's actually very warming. And I would say the number one key ingredient you want to think of during postpartum is ginger. Ginger in everything. Because
ginger is amazing.
Ginger is amazing. It's good now. It's good postpartum. It's good, you know, during flu and cold season. So that's actually the time to eat a lot of ginger and a lot of eggs too. You know, you can throw that onto your oatmeal or porridge. Avocado toast with some egg on top is a great snack for mothers. And the other thing is you also want to focus on fish soups too. That's actually something that I found is really recommended. A whole fish if possible. You basically boil it with some ginger and green onion, and that soup becomes very thick, almost milky. And that's actually because a lot of times Chinese medicine is like treating like. It's actually to help your milk production too. And there's a lot of like beautiful little synergistic things with food and Chinese medicine that I've been discovering, which is really fun. The second and third week is when you want to introduce a little bit heartier foods. That's when you're really trying to replenish your qi in your blood that you're lost. So that's when you want to start looking at other meats, like you could start adding in like beef bone broths. You can add in lamb, a little bit of lamb if you'd like, and just kind of adding in different flavors and having leafy green vegetables too. And then by the fourth week, that's when you are starting to like get back to normal. In Chinese postpartum, it's usually generally 30 days, a month. In other cultures, it's 40 to 45 days. And it just depends on where you're at, but always tweak if necessary. Like, for example, you know, you specialize in post-surgical acupuncture. The C-section moms, you know, they have to take it a little slower.
Yeah.
You know, it's a lot different recovery from a vaginal birth too. So you kind of have to adjust it based off where you're at, how difficult your birth was, and how you're generally feeling.
And I think just like to keep it very simple, because I love, like you said, there's so many synergistic things that we could get into intense detail with. But that's also with like working with a practitioner, why that's so amazing, because you can kind of help guide those postpartum moms. But just thinking in general, like easy to digest, warming, replenishing, like what would your body innately want if it's feeling depleted? Like those are the things that it would want. It wouldn't want some really difficult to digest, you know, burger and fried chicken.
Wow.
You know, it's going to be more nourishing foods. And like you said, like the idea like, oh, like salads and sushi, let's throw that in right away. They're delicious, but those, you know, cold raw foods are difficult to digest on the system. And something, you know, we talk about a lot when it comes to our medicine is like Like if you ever go to a restaurant with a bunch of acupuncturists, like nobody's having ice, right? So everybody's like, oh, water, no ice, water, no ice, water, no ice. And it's kind of this joke for us. But, when I tell patients, well, would you get up first thing in the morning and jump in a freezing cold shower? Like, would that feel good to your body?
Yeah.
And they're like, no, like that. And I'm like, okay, well, if that's what your outer most protective layer doesn't like, how could your inner layer that's even more sensitive possibly like that?
Yeah.
So, and in that postpartum period, when you're trying to support and nourish, you want to think about, okay, well, if I was run down and exhausted, if I was sick, if I was nursing myself back to health, what types of things would I want to put in my body?
Mm-hmm.
And it's not cold raw foods. It's those
Yep.
warm, nourishing, easy to digest things. So,
Yeah. And that's really hard for a lot of people because they go through 9 months of withholding, their favorite foods like sushi and red wine and salads and that Italian meat sandwich, deli meat sandwich. And so the first thing, all they can think of is, I just want to have that, what I've been missing out with, you know what I mean? But, I just want to stress to tell people like, what's another month?
yeah.
What's another month in the long term? So I think people,
And really putting a lot of support into that month sets you up for success in the future.
yeah,
Like putting off that support is not what's gonna like give you the biggest bang for your buck.
yeah,
Really focusing in on, like you said, it's just another month, taking that time and making sure you're supported and doing the right things for your body really does make a huge difference going forward in your overall recovery. So the other thing we wanted to talk about today is, postpartum is neglected in general a lot of times. And now during the COVID pandemic, I mean, everyone's focus is different. And a lot of times, like rightfully so, there's, a lot of modifications that have been made. Even when people are going in for labor and delivery or they're going in for their doctor's visits, not being able to have someone join them,
yeah.
it's changed a lot. So what type of things are looking different with the COVID
Mhm.
pandemic that we need to be aware of and thinking about?
Yeah, so it's very difficult because I think you've also heard the stories that women are going into labor alone without their partner. They are going into labor with a mask on, which is, I can't even imagine that. I can't even imagine that. And now, when they come out of it, they're really alone. Women that may not have even thought about putting a framework or a community together for their postpartum, it's actually even harder, especially for me. Like I kind of knew going in that it would be a confinement period, but women now who are going through the postpartum, they don't realize that that's what they're being forced to do. It's
Right.
interesting because women are being forced into this confinement, which in some forms can be the ultimate self-care, but other times can be very isolating. And also, women just don't know what to do. It's a lot harder than women realize. Everyone has something that they're going to have to deal with alone that just brings up so much. You don't even, every women's postpartum is very unique, but there's a little bit of trauma that they don't even realize until they come out of it.
Yeah.
I think it's an opportunity for women to really just focus on time with their child and themselves. But at the same time, what do you do when you only have your partner, or if your partner is going back to work
Right.
and there's no
Or
one,
if your
just you
plan
and the
was to
baby?
have your mother who's
Yeah,
older come across the country and help you,
yeah.
and that's not,
And
something
that's
that's
not
possible.
feasible, right? Like no one can get on a plane these days, right? And I keep thinking, what can women do to support themselves, right, during this time? Women that are pregnant going into it, they really have to start thinking about their needs. What are their triggers, right? Um, there's a lot of stuff that they're going to have to let go, and they're going to have to go into it knowing that, like a clean house, you know what I mean? Like friends dropping in to help them out, you know what I mean? you won't have that friend that can come over. You know, a lot of people say, you know, have a list of things that you need your friends to do and delegate it out to them, right? We're not
Mm-hmm.
going to have that anymore. So what's the
Right.
workaround for that, right? It may be something that your the partner at this time really needs to step up at this point. I think that's the biggest takeaway. You know, that they're going to have conversation. Here's the list of things that I need you to do, and you're going to have to do it for me. In terms of friends can still help out in a way by dropping off food, for example.
Mm-hmm.
You know, the contactless solution is to drop food, say hello, and then kind of leave. And that already puts a lot of pressure off, because a lot of times you don't even know when you're going to eat. When is your next meal going to come when you have a baby? You know what I mean? You have to
Yeah.
nourish yourself in order to nourish your baby at the same time. So that's something to also think about. And it's going to be really difficult. I think a lot of times, the women that I've spoken to, we always say, I wish that someone had told me how hard it was. I wish someone had told me how difficult it is for the physical recovery. I wish someone had told me, if you have a C-section, you can't drive for 4 to 6 weeks. I mean, it's not an issue now, but in normal circumstances,
Right.
C-section moms can't even get out of bed. So like, maybe you need to set up like a little step stool at the side of your bed, or put your mattress down on the floor so it's easier for you to grab your baby to feed the baby. There's just things like that that's a lot more difficult. I actually suggest that women have, you know, a lot of women hopefully have friends that are kind of in the same boat. Like, once you start having a kid, a lot of your other friends start to have kids, right? Kind of check in and be like, what kind of birth did you have? You know, did you have a vaginal birth, C-section birth? Write that down. And then as soon as you figure out what happens and you're outside of it, you can have that immediate mom group to know, like, oh my God, how did you recover from this? Like, what are your suggestions on the breastfeeding? Don't forget about the network you have that's already there, that want to help you, who, you know, women want to help each other. It's very overwhelming how much women want to help, but a lot of times the worst thing you could do is say no, or say, oh, I'm fine.
I can do it. I can do
I
it
can,
myself. I can handle it.
yeah, yeah,
Well, I think a lot of those things too, like you mentioned at the beginning, are passed down culturally. And sometimes, that's not happening here. Also really, we had a teacher, Dr. Chang, who, deals a lot with postpartum. And her biggest thing was like, well, just have as much planned out as humanly possible
yeah,
before it happens.
yeah,
Because there are going to be things that come up that you can't control, that you didn't anticipate, but for things that you can, like she prepared all of her meals and froze them
yeah,
and then just defrosted them and, had her bone broth ready to go, like had all of these things. So it was one less thing to think about.
yeah,
Um, and I think like you also mentioned, like not shutting people down and saying no.
yeah,
It's amazing to me. Any pregnant woman or postpartum woman that I've ever treated, there is this pressure to just act as if this is the most perfect time and everything is great. Because I think there's a fear of being perceived as a mother like you're not excited or grateful. But at the same time, like pregnancy can be very uncomfortable, emotionally, physically. Birth is a trauma that happens. Postpartum is a recovery time that needs to occur. And a lot of times in American culture, it gets like, well, you got to deal with it. Shouldn't you be happy? There are women who, are getting fertility treatments. You should be so grateful that this thing happened to you. And just being able to have the space as a woman in the postpartum period to say like, wow, this was really hard. And this is still really hard. To have a support system that will let you just be in that way. And that can be, your partner, it can be your friends, it can be a practitioner. I'm a big fan of enlisting practitioners in this process because like, I know when I've healed from an injury, I know how to treat injuries, but I don't want to be the one driving that treatment plan.
Yeah.
You know, I just want to focus on getting better.
Hmm.
And it's the same thing with that trauma of birth. Like, you should be able to rest. You should be able to spend time with your baby. You should be able to focus on just that. And, you know, have a practitioner who's telling you like what you should be eating in weeks 2 to 3
Yeah. And
based
that's
on
what I want
your
to,
individual pattern.
yeah. And that's what I wanted to really touch on too. How can practitioners support the postpartum mom? And the first thing I want to, some people may not be aware, but for a vaginal birth, after you have your baby, you see your OB in the hospital, and that's it. They're done.
Yeah.
You don't see them for another 6 weeks. You have a 6-week checkup. They check you down there. They do another exam. And after that, they're like, okay, how are you feeling? Do you think you have postpartum depression? I can give you a therapist. And that's it. That's all. For C-section births, there's 2 touch points, week 2 and week 6. Week 2, they just check your stitches, tell you not to hold anything heavy. And then they pretty much say, okay, I'll see you in 6 weeks for your vaginal exam. After that, it's gone. That's it. That's it. It's crazy. So what I feel that practitioners can do, and I think there's such a focus on getting a woman pregnant, like you said, and fertility. It's so important to kind of be that person through the entire cycle. So just checking in with them, finding out when they give birth. After that, just being like, are you okay? Are you okay? Because we are primary care, providers in California, why not just kind of ask them about, check in to see if there's any red flags that you have to be worried about. There's nothing worse than being alone in isolation, Googling different things. There's so many women. There are women that have told me, I didn't know that you bled for so long after you had a baby.
Yeah.
Of course it's normal, but you also have to realize that there are instances where it's not normal, right? Where you bleed a little bit too much. And then there may be some hemorrhaging inside or internal bleeding that you have to take care of. So in terms of a practitioner standpoint, keep checking in. Just because you got them pregnant, your job is not over. Because right now, especially, I know everybody is concerned about going into an office. So there's so many things you can do via telehealth, even if it's there to teach them acupressure points, there to find out how they're doing, writing them an herbal formula if they have an undersupply of milk, right? If they're feeling completely depleted, there's so many formulas we can do to boost chi and blood. And also just to be there as a support. I mean, half the time we're in a clinic shift with a patient, they're just talking. You know what I mean? It's
Right.
their opportunity to just chat. And that itself can be so therapeutic.
Yeah. And I think, you mentioned the herbal medicine, but like, how cool is that herbal medicine can help with milk, that can help expedite healing, that it can help with bleeding. Like, I graduated years ago, and I still, every single time I have a patient, every single day I'm learning something. Like, it's amazing to me. And I think, herbs often get underestimated, but what I'm seeing in this telehealth period that we're having now is people are more open to herbs, because they're a little hesitant maybe about coming into the office. I've stayed open. I've still been treating with acupuncture, but being able to enlist telehealth as an additional thing to really dive into with patients who don't want to leave their homes, who are quarantined outside of LA, who, yeah, like maybe they had a baby and leaving their house is like the last thing on their mind. Nutrition guidelines, we've been really able to open up the other aspects of our scope of practice beyond the needle right now. And for postpartum mothers, like, herbs and nutrition are huge. Like, you can do so much outside of needles for a postpartum woman. And herbs are so cool because they work with your body's physiology. Like, it's not like taking a pharmaceutical medication where you're shutting down a signal or making a symptom be quiet, but we're not addressing the underlying issue. It's really boosting the actual underlying issue that's going on to help with any underlying deficiency and really help your body rebuild, which is so appropriate for postpartum.
Yeah. We have a lot of tools. luckily. And unfortunately, we're boxed into just needles and acupuncture a lot of the time. I
Because
mean,
we're called acupuncturists.
It's very snappy. Like, I don't know. It's good in terms of like a snappy name, but like there's
Right.
just so much that's involved. There's also qigong, there's meditation, there's, like you said, herbs, there's nutrition, there's lifestyle. I mean, even simply as when you're talking to a mom, you notice a glass of cold iced coffee next to them, especially since it's going into summertime. It's like, even those
Yeah.
small things can make a big difference, right?
Right.
There's so much in our tool set that we should really take advantage. And I honestly think that for postpartum, telehealth is probably the best solution. Even coming out of COVID, it should be what we're doing for postpartum women. In it just continues the care. For women, it lets them know that we have not forgotten about them. And they'll keep us in mind for so many things, because when you think about it, just from the life cycle, from pregnancy to postpartum, don't forget the baby. We can do a lot of great things with pediatrics. Pediatric acupuncture is amazing. Those little bodies, they just love it. They
respond so quickly.
So quickly. It's like magic. Sometimes it's a really beautiful thing to watch. It also kind of like, when you think long-term about acupuncture in our field, what's the best way to introduce it to the next generation? It's through children, right? When they're familiar with it, they were like, oh, remember this thing that didn't hurt? Remember those herbs that I took and it healed me and I didn't have to get a shot for it or something? There's so much opportunity.
Yeah, absolutely. I love that you say, telehealth, even moving forward, is what we should be doing for postpartum women, because I absolutely agree with you. I think, in our field, it's been so heavily focused on the needle, and this situation has made telehealth a little more in the forefront and other aspects of our practice, but also that's, we need to acknowledge it's not something that's going away, nor should it. Like, telehealth should stay, because there is so much that we can be doing for people without having to physically lay hands on them. We went through a very comprehensive medical program. So we should be able to use all of those incredible tools to help people who, might not be able to physically access us, or, want to be in the comfort of their own home. And I've been really surprised by how beneficial acupressure is. And I think it's so interesting in a period where someone is trying to regenerate and recover, because it does promote like this self-cultivation of healing and energy, where you're not relying on another person to lay hands on you for that exchange to happen. I've really seen how people are learning the acupressure process, and then with taking herbs, with doing proper nutrition, with exercise or meditation or qigong, like, they are able to regenerate. And that's what we want anyway. Like, the body is innately intelligent, so we just want to help push it in the right direction, because the body already knows how to heal.
Yeah, the body is constantly trying to reach homeostasis, right? And it just needs a little nudge. Acupuncture is great for that, but there's just so many other ways to do it too. And the thing is, what's important to know is that some people may respond to some things better than other things, right? For some people, it's the food to change their chemical makeup in their body. For some people, herbs are better. You know what I mean? For some people, qigong is better, because maybe there's too much going on up here, right? That's affecting the body, the psychosomatic relationship. And it is a lot of self-discovery and figuring out what it is that works best. And the fact that we have so many different ways to reach that and reach that healing turning point is what makes our profession really great.
Yeah. And I always, I don't even know where I initially heard this, but it's something I've really internalized and have taken on. But, the idea that the patient is the hero in their own story. We are just a guide
Yeah.
We're just like an educated guide who helps facilitate that. But they're the hero, you know, their body is what is going to make this healing happen. And that's how it should be. So, I've loved this talk. I feel like it's been so informative. If anyone wants to reach Debbie, I did put both of our Instagram handles below for any additional questions. And I'm going to save this video as well. So if you guys have questions that pop up, you know, feel free to reach out to both of us. Any last words you want to say, Debbie, before we wrap up?
I just want to say that we're all in this together. You know, if there's any pregnant women watching, like, you know, reach out to any of us to get some tips on how you can better prepare yourself. Just having the right things at home, mentally preparing everything. To the practitioners that are on, this is a great opportunity for us to be really supportive. I feel like there's such a big emphasis on the baby. You know what I mean? Just because we have like the ultrasounds and, you know, everything is focused on a healthy pregnancy and a childbirth and a labor, but let's not forget the moms. You know, it's a really, really fragile time. It's a very tough position to be in, especially in isolation. And even a simple text to your patient who is a new mom, or even a friend that just had a baby, makes a big difference. Just letting them know that they're there. If you could send something to them, if you could drop a healing bone broth to them at their doorstep.
Yeah.
Even if it means like, you know, someone who has like a level 4 tear, and then you send them like a little sitz bath, you know what I mean?
Yeah.
Them. Or even if it's a mom who just had a surprise C-section, sending them like a belly binder, or, you know, even a scar, something to help their healing process. It all makes a huge difference. You know, ask about the mom, ask how they're doing. I know the first thing is to say, like, how's the baby? You know, show me pictures of the baby. You never see pictures of the mom. First of all, they feel like crap. They probably look like crap. And
They're like, I don't want to be on camera.
Yeah, but just asking them if they're okay, just checking in, and then checking in with them, not just one and done, but maybe just weekly. Weekly for a couple. It doesn't take any time to do that. And I think that it would make a world of difference for someone knowing that you're thinking of them.
Yes, absolutely. And feel free to reach out to us, anyone who's watching, who, you know, wants some ideas about how they can support as well. Even if, you know, you're not a mom who's watching, you're someone who wants to support a new mom, we're happy to give suggestions on that as well. So, Debbie, thank you so much for joining. I've loved it. You brought so much knowledge, so much value. And yeah, anyone feel free to reach out. We're here to help.
Thank you, Dr. Nell, for this opportunity. It's wonderful.
No, great to talk to you. We'll talk soon.